Welcome. My name is Brad Siff. I'm the founder and president of BioWave. I'm really excited to be able to introduce you to our guest speaker for our webinar. It's Rick Griffin, who was the former head athletic trainer for the Seattle Mariners for 35 years and is now the emeritus athletic trainer for the Seattle Mariners. And Rick's presentation is on using BioWave to treat baseball and softball injuries, best practices and protocols. And before I go, at the end of our presentation, if you have any questions, we do have a Q&A session that will be live. Just take your mouse and click on the Q&A button toward the bottom of the screen, and we will be happy to answer any questions that you have. Thanks so much. And with that, I'd like to introduce you to Rick.
Hello, everyone. This is Rick Griffin. I'm happy to be here today to talk to you about BioWave and how to use it in treating baseball and softball injuries. I was lucky enough to be able to use this product for over 15 years in the professional setting with the Seattle Mariners, and excited to share what I've learned. This is a little bit about my background. Obviously, I'm not going to read through this and bore you with it. You're more than welcome to take a look at that. But I started as a high school teacher, and in the summers I worked minor league baseball. Then I was lucky enough to get hired at a elite sports medicine clinic and was kind of mentored by one of the better sports medicine physicians in the country. And then I was very lucky to get the head athletic training job for the Seattle Mariners, which I held for 35 years. Along the way, I worked a lot of professional rodeo, did a lot of other events, road races and things, always stayed involved, was involved in a lot of different sports, but you can read through that. I didn't want to take up too much time on that. One of the things that I feel is really, really important in treating athletes, particularly athletes who are competitive, in my setting, they are all extremely competitive, is you have to have a treatment philosophy. And this treatment philosophy is going to allow you to develop better care. It's also going to allow you to develop better trust with your athletes. And trust is one of the most important things that you can have with your athletes, so that you guys can get on the same page and you can work together to promote healing and get the best results. But one of the things that mistakes are made a lot on are developing a treatment plan. If you don't have the right diagnosis, sometimes the treatment plan you have is going to go awry, and it's important that you develop a treatment plan with your physician. If you have a good physician and you have the opportunity to go into the room when they're doing the diagnosis, I'd strongly recommend it that you do that, because you'll learn how his process is, how his evaluation techniques are. And a lot of times you'll learn things, but it also gives you an opportunity to interject what you saw, because likely you saw this individual get hurt or they have the injury, and you have some knowledge that's best passed on to the physician. If you can do that in the room when you're doing the evaluation, that will help him come up with his diagnosis, as well as give you the opportunity to express what you think is wrong. Imaging is really important to make sure that you get things right. In this day and age, it seems like everybody gets an MRI, which is fine. Excuse me. But you can also use bone scans or CAT scans. Normal imaging a lot of times will show things, but that's obviously up to the physician on what he wants to do. But it doesn't ever hurt for you to possibly make a recommendation based on what you think or what your experiences are. But primarily what we're trying to do is reduce pain. Obviously, that is the most important thing, because if they have pain, they can't play or they can't produce at the level, and it's going to stop them from performing. So reducing pain is crucial. Inflammation, and then swelling. We have to get the swelling out. I had a physician one time tell me that swelling is like glue in a joint. And if there's glue in the joint doesn't function properly. So you really have to focus on reducing the swelling and reducing the pain. And then protect the athlete. And the reason I put that in there is sometimes the athletes don't want to have the protection that they need to get better as quickly as possible. And a couple examples are, say a guy sprains his ankle, or maybe he stretches his Achilles, and the physician or you recommend that he leaves the training room, or he leaves the area where he's performing in a boot. And his thought is, well, I don't want everybody to see me in a boot, or I don't want everybody to think that I'm hurt so bad that I have to have a boot on. All you're trying to do is protect the athlete. And you have to talk to him and explain to him or her that the reason that you're doing this is for protection and quicker recovery. Same goes with maybe wearing a splint on your wrist at night. that it's important if you reduce motion with a splint at night, that'll help. So protecting the athlete sometimes by putting them in either a splint or a boot or a cast or a sling, those are crucial things to help speed the recovery. And that takes communication with the athlete on the reason that you're doing it. And that's leads right into communication. I really believe you have to communicate and explain everything that you're doing to get the best results. Mental health is really important, and mental health is a really hot topic in athletic training and the treatment of athletes now, and patients for that matter. It's really important that we do everything we can to include them, to keep them on the same page so that they understand what you're trying to do. If they understand what you're trying to do, they're going to buy into it better, and you're going to get better results down the road. And by doing that, it allows you to develop a precise plan to treat the injury. You always want to use the most up-to-date and best evidence-based protocols. And it's really important that you try to stay up to date, that you spend time reading articles, going to seminars, talking to individuals who have more experience so that you can get the best evidence-based treatment. But don't forget to take into account the experience, certain things that have worked in the past, certain things that you have done. And on the other side of the coin, make sure you don't repeat past mistakes. You want to make sure that you're staying current and that you're doing things that are evidence-based, but use your experience and guide yourself through the process of treating the injury. And then also remember that every injury is different and every injury requires a certain type of treatment. Just because you've seen a sprained ankle or a sprained knee or an injured shoulder before doesn't mean that you're going to treat it the same way that you did the last one. You have to take into account so many factors, but make sure that you individualize your treatment plans and try to develop a game plan if it's an acute injury, if it's a chronic injury, or an overuse injury, because each one of those come into play when you're trying to develop a treatment plan. As I mentioned earlier, it's really important that you engage the athlete that you're treating in all aspects of the treatment. It's really important you show that you care. By showing a caring attitude and taking the time to explain what you're doing, studies have actually shown that you're going to get better results, you'll get better buy-in, and you're going to have a better result with them in the whole treatment process. The use of modalities are crucial. There's so many different modalities out there now. It's important that you research, that you try them out, you listen to your athletes when they use them. You're going to get the best and most honest results from your athletes of whether or not they work or not, and we'll talk about that later. Manual therapy, the ability to use your hands is crucial. Take seminars, use the different type of techniques such as, manual therapy techniques such as ART and MAT. Exercise prescription to get your athlete back on the field is very, very important, but it's also probably the common area where people make the most mistakes because they try to overload the exercise prescription or programs too soon. You have to go in a sequential order, make sure that you don't overload them. I really strongly believe in acupuncture. And I'm not talking about dry needling, I'm talking about acupuncture. I was fortunate enough for 17 years to have a Japanese athletic trainer / acupuncturist on my staff. I actually recruited that individual after being to Japan on a number of trips and learning the importance of acupuncture and their style of treatments and Japanese baseball players. And so we had one, and now almost every team in the major leagues has an acupuncturist, either on staff or that travels with them. And then the use of massage therapy is also crucial for recovery, particularly in baseball and softball, because so many games are played over such a short period of time. And then the use of hydrotherapy is good. Chirotherapy obviously has its place, but again, you have to be careful and you have to use it correctly. And try to avoid the shotgun approach. Just because you have a lot of modalities doesn't mean you have to use every single modality. You have to know the reason you're using the modality, and you want to understand the benefits that you're getting from the modality when you use the modality. But don't just use a shotgun approach where you try 6 or 7 different things, because you don't really know for sure which one is doing the most benefit. And the other side of that is you could be actually causing harm, and you don't know which one's causing the harm. So make sure that you use the modalities the proper way. And then follow-up visits with the physician for the progression of the injuries. It's really important psychologically for the athlete to know that he's making progress. And it's good that he's hearing that from you and that you're showing him by the exercises that you're doing or the treatments and the swelling's going down. But it's always good if you can to get him back in or her back into the physician, so the physician can give them some good positive reinforcement. They'll continue to work hard if you can do that. And then, of course, if there's something that's going on that needs to be reanalyzed or revisited, then it's good for the physician to be involved in that as well. And then something that I see quite a bit is continuing treatments pre and post game when you return. It's amazing to me, not so much in the professional setting, but it's amazing when high school and college athletes, they have a surgery or they have an injury and they do the rehab, they do the exercises, they get better and they get back to playing. And then they stop doing this exact things that got them to where they needed to be to start playing. They feel because they've recovered from the injury that they don't need to continue their treatments pre and post game and also their exercise routine. So make sure that you encourage your athletes to stay on the programs, the pre and post game treatment programs that you use, and also their exercise routines. And then another thing that's really important as a clinician, as an athletic trainer or therapist, is when you go through and you get somebody recovered, you've taken them through the process, either it's post-surgical or recovering from an injury, take time to gather with your staff and go over what you did and the progression, to see if you can learn from any mistakes that you may have made, and also for reinforcement that the things that you did were well done and that they were done in a timely manner. It really helps a lot if you can review the things that you've done when the next injury comes up, because it gives you a good idea of what you've done right. And you always want to continue to try to improve your treatment protocols. And you want to do that by staying up to date, by making sure that you review what you've done. I wanted to talk to you specifically about some of the ways that we used, my staff and myself, that we use the BioWave in our pregame protocols for nerve stimulation to reduce pain and to help. It actually helps promote warm up. We found, I'll give you a couple of examples of that, but some of the pregame treatments that we used, and I'm talking particularly about pitchers, softball pitchers and baseball pitchers, 70% of the injuries in the professional setting in Major League Baseball are pitchers, and it's elbow and shoulder. So obviously we're spending a lot of time working on shoulders and elbows. Contrary, 30% are to position players, and most of those injuries are soft tissue to hamstring, groin, calf, and oblique muscles. But I wanted to talk about pitching and using BioWave for pitchers. The treatments, we usually did the treatments within an hour and a half of the game, and the treatments usually lasted for 20 to 30 minutes, depending upon what the condition was. And we had really good benefits for pain and also for warm up. The treatments usually, the benefits from the treatments usually lasted about 4 to 6 hours. Most of the time, the games last around 3 hours. If it's a relief pitcher, they're down in the bullpen. They're still going to have benefit from the treatments 2 hours into the game, because we found that the treatments were getting benefits for 4 to 6 hours the majority of the time. If it was a position player, we would usually do a little bit longer treatments, because again, it was possibly a hamstring or a groin, so we want to get a little bit longer time. But most of the time, our pitchers, we did those about for 20-minute treatments. We had really, really good results with shoulder discomfort, both posterior and anterior. We get a lot of bicipital tendonitis. We get some trigger points and some knots a lot of times in the posterior aspect of the shoulder. We had really good luck putting one of the pads directly over that area before the game. It helped to loosen it up, and we had good results with them going out and coming back and telling us that they warmed up quicker than normal and they felt really good. So that was one of the things that we had good luck with pitchers, with placing the pads anterior and posterior. Also with flexor bundle forearm discomfort or tightness. Chondromalacia and patellar tendon problems are very common in baseball, again, in the infielders, but also in pitchers on their landing leg. So we had good luck using the pad placements for chondromalacia and knee pain. Achilles tendon discomfort was also a good one. Plantar fascia pain, putting the pad directly over the pain, a lot of times completely got rid of the pain, and they were able to compete and play the whole game. And then we did post-game treatments. And then low back pain, minor muscle spasms or stiffness. Again, the pad placements can be determined based on the specific need that you have, but those are the injuries that we really had good luck with. And one of the great things about BioWave is they have a whole library of pad placements that you can go on and you can actually look up for specific injuries. You can get an idea of what they recommend for the pad placements. But as you use the modality and use BioWave, you'll come to develop your kind of placement programs, what work best based on the athlete's feedback. But they do have a great library that will allow you to determine pad placements. And then what we did in our organization is we did not use ice in conjunction with BioWave and the pregame treatments. And that's pretty much universal to not use ice before, particularly in a pitcher before he goes out and pitches in a game. But we never did that. And that's something I think that's a good thing to adhere to. I would like to talk a little bit about the post-game protocols that we used with BioWave. And again, a lot of these treatments are based on pitchers, softball pitchers, baseball pitchers, because there's so much micro trauma over the course of a game. If you really analyze the number of pitches that are thrown in a game, and it's much less now than it used to be, but the pitchers obviously are throwing harder now, the starting pitchers particularly, than they used to. But if they throw 100 pitches in a game, they usually have 25 to 30 tosses before they get on the mound, before the game starts to do their pregame warm-up. And then they throw another 45 pitches in their warm-up, and then they throw 8 pitches in between each game. And let's say they go 6 innings. So that's another 24 pitches. And that doesn't count maybe throwing over to first base. It's very likely that over the course of one game that the starting pitcher's throwing in excess of 200 balls. And there is a lot of micro trauma that takes course over that. And the BioWave really helps with recovery post-game. Again, we used anterior and posterior shoulder placement, always 20 to 25 minutes. And most of the time, my players like to do it in conjunction with ice. It doesn't have to be with ice, but we had very good luck keeping our pitchers healthy using BioWave with the pad placement and ice for 20 to 25 minutes. Same thing with forearm bundle pain. Again, a forearm bundle pain, talking about soft tissue, not ligamentous. Obviously, if they got ligamentous problems and discomfort, that's something that needs to be addressed. But for muscle stiffness, muscle pain, pronator teres, muscle tightness, we had very good luck again using BioWave. When we did ice on the elbow, we always did it for between 15 and 20 minutes. We never went more than 20 minutes because we didn't want to have any irritation with the ulnar nerve. And when you first start doing these treatments with ice, if they haven't done it, you need to check after about 15 minutes to make sure they're not getting any tingling in their small finger, in their small finger in their hands. We had good luck with people who had patellar tendonitis, chondromalacia particularly. I had one outfielder, which is a case study we'll talk about later. He used BioWave after every game. He iced his knee and used BioWave after every game. And he liked it so much, he actually bought his own unit and he was doing his own treatments, which is, I'll get into later, another reason I like BioWave, because it can be taken home and used or on flights or buses. One of the things with catchers that I think really, really helps, they have a lot of micro trauma too. I'd mentioned earlier that the pitcher's going to throw 200 up to 200 balls in a game. And that's if he goes 6 or 7 innings. And then the relievers are going to come in. So the catcher is catching probably on average 280 to 320 balls over the course of a game. And he's going to get micro trauma in his hand and also in his thumb. So using BioWave on the thumb of a catcher in the thenar eminence and also over the ligament is really important. It helps reduce inflammation and pain. And that's another thing that we did. And we usually would do that treatment for 20 minutes as well. I want to talk about the use of BioWave with post-surgical protocols. There's a couple things that you definitely should not do, but BioWave can help reduce pain post-surgically so they can get into their rehab program and doing their exercises quicker. Also helps control the pain and helps with inflammation as well. But the one and most obvious thing, and I know everybody knows this, is never place the electrodes over the portals or the incisions. You're going to work on the side of or above and below the incision site or the portal site. But I just wanted to bring that up. I know everybody knows that, but it's just important to make sure that that's understood. Doing this post-surgically can help decrease pain with proper pad placement and treatment time. And we would do, a lot of times we would use on post-surgical, we would do the treatment times of 30 minutes. And we would do that multiple times per day. And depending upon what the surgery was, you can also use that with ice. If they have swelling, you can use it with ice to help control swelling. We had really good benefits with using 30-minute treatment times. And then once you start the rehabilitation process and the strengthening progressions, you can use the BioWave before the process of exercise, because it will help reduce pain and it allows the athlete to do more exercises and they get better results. And it helps with their range of motion because they're able to utilize their muscles in a more correct manner. So I would strongly recommend that you try that and do that. But do not use ice if you're going to plan on doing exercises prior to that. But you can use the BioWave with proper pad placement before exercise, but I would stay away from using ice. Okay, I'd like to kind of walk you through a couple of case studies. And the reason that I did this is I think it's important to show the different ways that you can use BioWave. You can use them in somebody who's basically healthy to get better recovery before their next outing. You can use it for somebody who's had a surgery, and you can use it with people who have chronic and or acute injuries. But this first case study was a 34-year-old starting pitcher. He'd been in the big leagues for 12 years. Luckily, he had never had surgery on either his shoulder or his elbow. He usually had post-game soreness, and then he would be sore the next day to the point that we would do certain exercises. We'd get him in a pool and do hydrotherapy workouts. And he just had a sore shoulder that was due to wear and tear. This guy was tremendous as far as his conditioning and his pregame arm care routine. Did a wonderful job, which is one of the reasons I think that he stayed healthy. And I had this guy for his entire career. And so we came up with a pregame treatment plan. And the pregame treatment plan consisted of using BioWave with our pad placements on the front of his back of his shoulder. And we'd put the BioWave on for about 10 to 12 minutes. And then we would put a hydroculator pad over the pad placement for 10 minutes. And he really liked that. He felt like that helped him warm up better. He said his shoulder warmed up better. He felt like he didn't have to throw as many pitches warming up. He felt considerably better doing that before he went out and started his warm up. After the game was over, he would come in and we would use BioWave on his shoulder with pad placement in the teres minor area, teres minor, and up in the front of his shoulder near the attachment of the supraspinatus and the bicep tendon. And we would put the pad placements there, and then we would utilize ice for 20 minutes. And then the next day when he came in, before he went and started his exercise routine, then we would do a BioWave treatment of 20 minutes using pad placement in the front and the back of his shoulder. And we started to do that the last 5 or 6 years of his career, because his career was winding down and more wear and tear after pitching that many years in the big leagues, plus his college career and his minor league career. But it just enabled him to continue to do his arm care routine. He felt like he got better muscle recovery, and it helped reduce the discomfort that he experienced. So we had a really good pregame treatment plan, postgame treatment plan, and then we follow that up the first day. And then when he would, most times in the major leagues and colleges, even high schools, they'll have a bullpen day in between their starts. It's part of their routine to stay sharp and work on their pitches and their command. Before he would throw his bullpen, which is usually the third day, he would come in and we would do a BioWave treatment, put the pad placement in the front and the back of his shoulder. And then the fourth day, we would do the same thing, and then we would restart our treatment plan. So he basically was using the BioWave 4 out of 5 days in between his starts. And like I'd mentioned, he bought his own unit, and he would go home and he would do treatments at home on his own, which is, I think, tremendous to be able to have a modality that's easy to use. that you can trust that they're going to use it properly, because if you teach them how to use the equipment and the pad placement, they can do their own treatments. And he would take it on the airplanes. He would take it on the hotel, to the hotels after the games on the road. And so he used his own, and it really stimulated a lot of the players buying their own unit. And there's the smaller unit and the larger unit, but it was a very comforting feeling to be able to know that they're using a modality that you can trust and that you can teach them how to use it properly and getting good results with. Okay, the second player that I had a case study I wanted to talk about. This was a 30-year-old starting center fielder that we acquired in a trade. And when he showed up in the training room, the very first thing he told me, he says, well, I just want to let you know I have really, really bad knee pain, and my knees have bothered me for the last 2 or 3 years. And I have pretty bad chondromalacia. And sometimes I can only play 3 or 4 days in a row. And I'm willing to try anything that you have to help me so I can get better. So he was immediately evaluated by our physician. We got an MRI, we got x-rays, and he had grade 4 chondromalacia, and it was significant. He also had some patellar tracking issues, and he had some quad issues that needed to be rectified from a strengthening perspective. But the main thing that we did is we started him on an exercise program, and then we started to use BioWave pre-game and post-game. And again, this athlete, after a while, he bought his own unit as well. But before the game, he would put pad placements on either side of his patella, just at the distal pole of his patella. He did a 20-minute treatment, and then he would go out and he would play the game. And then he would come in after, and we would ice, and then he would do the same pad placements with the BioWave after the game was over. He was an all-star that year. He basically played, I don't think he missed more than 4 or 5 games. He never missed anything because of the chondromalacia, because of the knee pain. He continued his exercise program. I had the player for 4 to 5 years, and he really, really never had any problems. And he's now working in professional baseball as a coach, still doing well. But basically all we did is put him on an exercise program, and we used BioWave for help with pain control. And it really made a huge difference for him to be able to go out and play on a daily basis. So that was a great thing. And then we also put him on a home treatment plan, and he would use his once in the mornings before he came to the ballpark, and then he would take it at night, sometimes especially on the road in the hotel, and he would do another treatment in the hotel. So had great results, and he became a very good player for us. This is another position player, number 3, 26-year-old starting third baseman. He tore his meniscus on a slide, and he also had some mild chondromalacia. So he went in and had surgery, had his patella scraped, and we had to develop a post-surgical treatment plan. This particular athlete did not have the highest pain tolerance. It was to the point where we couldn't really even get him to do a quad set because he said it hurt too bad. So on the third day, we started to use BioWave for pain control and for treatments. And we did a 20-minute treatment, and then asked him to do some quad sets, and he was able to do them. And he didn't have as much pain. And then that progressed into him being able to do some quad sets and straight leg raises, and start our exercise program that we needed to get him on. But again, you have to make sure you don't put anything over the portals or the incisions. In this case, we used the BioWave for pain control, so that he was able to do certain exercises. We did that pre-exercise program. And then on day 5, we started to use it mostly for range of motion and pain control. And then he was on his pre-hydrotherapy treatment plan prior to the 10th day. On the 10th day, we did the BioWave treatments, and then we put him into the hydrotherapy, and we started doing a lot of exercises in the hydrotherapy program. His pre and post strengthening exercise treatment plan was really helped by him able to not have as much pain, and the BioWave really helped with that. And then we started him on a return to play progression and treatment plan, and he did make it back in about 6 weeks. We were fortunate that he got back in 6 weeks. We were hoping to have him back in 4, but he made it back in 6. But in this particular case, post-surgical, BioWave really helped with pain control and pain management, so that he was able to do the exercises, and it gave him confidence, particularly at the beginning, where he felt pain everything he tried to do. And when we did the treatments with the BioWave, he did not have any pain, and we were able to get him started on the treatment. So I just wanted to share with you those three different types of ways to use BioWave. You can use it with, an injury post-surgical to help with the rehab process. You can use it in someone who's not necessarily hurt, but has some wear and tear. And then you can use it for somebody who's got more of a chronic injury, like condylation, the patella, to help keep them on the field. So those were just three case studies, and obviously have many, many more, but those were ones I thought would kind of relate to what we're trying to talk about. Okay, so in summary, wanted to just point out my opinion of the best way and the best benefits for the use of BioWave for treating baseball and softball injuries. And I had mentioned a couple of times about how much we use this on pitchers, softball pitchers and baseball pitchers. We're very, very fortunate in professional sports to be able to get a wide sampling of all of the new products that continually come out over the years. And I would always take those products to spring training, and I would allow the players to try those. And the players really tell you whether or not things are working. And it's funny, my players nicknamed this the blue box. So we started off with 2 blue boxes, and we ended up with about 6. And then about half a dozen of the players on my team had their own blue boxes. So I can tell from the players that this actually worked, and they felt like it was giving them some benefit, or they wouldn't have purchased one after they had the opportunity to try it. But we had a lot of different modalities out, and almost all the time they went straight for the BioWave unit, which I think is important. And that's why I wanted to share this message, because I believe in this product, and I think it helps keep your players on the field. But you can use it in acute situations, you can use it in overuse situations, and chronic. I think the best use is helping to keep your players on the field, because it really helps with micro trauma. It helps in rehab because they're able to reduce pain and discomfort, allow them to get more exercises done, and allows them to progress through their exercise program, which is going to get them back on the field quicker. The best results that I had using this, I made just a short list here. Of course, anterior and posterior shoulder pain in pitchers. I would add along that some bicep discomfort, flexor bundle and forearm muscle pain. There's a lot of low back and facet issues in baseball and softball because of the rotational nature of the sport. And we had really good luck with pad placements using the BioWave to reduce pain and discomfort with facet syndromes, low back spasms, SI joint symptoms. Again, that comes from the rotational nature of the sport. But those 2 areas, there's a lot of small issues with back and SI joints, and we had good luck with pain control with BioWave. Really, really like it for patella and condylation knee pain. And then because we're on buses, we're on airplanes for long periods of time, a lot of times the athletes will fall asleep and they'll get themselves in some funny situations. They'll come in with cervical neck discomfort. And again, you can use the placement library that BioWave has, and you can kind of play around with that. But we had really good luck with reducing pain and discomfort, particularly in the cervical neck issues. And then, as I'd mentioned earlier, I really like it because you can instruct your athletes and you can teach them, and they can take it home, and it can be used at home, and they can do multiple treatments at home. And it really will give them some benefit. And they have a variety of different sizes that you can use and purchase that make treatment options and plans available for your athletes. So thank you very much for the opportunity to present to you and share with you my experiences. Obviously, happy to answer any questions that you have, and look forward to answering any questions that you have. And we'll take those now.
Rick, thank you so much for a really great presentation. So just reminding everybody, if you have a question, please submit it through the Q&A portal at the bottom of your screen. So let's see, we actually do have some questions that have come up. Rick, so the first question is, when athletes have their own units, what precautions and education do you help them with about taking care of the pads?
Yeah, that's really, really important because, I mean, the pads, Brad, aren't cheap, but they're very, very wonderful. They do a great job. But if you don't take care of them, you're not going to get as many treatments. And so they usually come in a plastic bag, and it's got a little Ziploc capability. So the first thing that I always advise them is make sure you don't have any lotion on your skin. You want the area to be free of lotion. If you have lotion on there, then that's going to kind of work against you, and it also works against the current being transferred to the proper areas through the pad, through the skin. So the area needs to be cleaned. And then when you get done using the pads, put them back into the Ziploc bag and make sure that you zip it properly. I was always able to get between 12 and 15 treatments with the pads if you take care of them properly. If you leave them out and you leave them exposed to the air, you're probably only going to get 6 to 8 treatments. Another thing that you can do, if the pads do get a little bit dried out, you can take just water and just put a light amount of water on the pad, and then take your finger and rub it along the pad, and that'll help to recreate some of the stickiness, and you'll be able to utilize the pads and use the pads a little bit longer. But the biggest thing is just make sure there's no lotion on their skin prior to use, and then keep them stored properly. And you'll get better use out of them. And as I mentioned, they are a little expensive, but they're well worth it. If you take care of them, you're going to get 12 to 15 uses out of them.
Thanks, Rick. I would just add that, we always recommend that you clean the skin. You could just take a damp towel from the training room and really clean the area well, because if you get all the dead skin cells off, when you remove the pad at the end of the treatment, it'll just stay fresher longer. It'll stay tackier longer. There is a plastic liner that they come on, so it's important to put them back on the plastic liner before you stick them in that Ziploc bag that they come in. And one last little pro tip, you could actually take saline, a few drops of saline as opposed to water if it's available, and the salt in the saline actually improves the electrical conductivity of the hydrogel after you rub it in and allow it to absorb in for about 60 seconds. Next question here. With a softball pitcher with posterior elbow pain, how would you use BioWave?
Actually have used it in that manner. The thing you want to do is you want to put the pad directly over where the pain is. Hopefully you have an idea of what you're treating by either MRI or X-ray. They may have a spur, maybe they've got some impingement in the posterior part of their elbow. But I would do a post-game and a pre-game treatment on this individual. I'd put one pad right over the pain, and then I'd move the pad down, and I'd probably put it on the lateral side of the ulna. And then I would do pre-treatments. I would do probably either try a hot pack, and then after they get done, I would do it with ice. I think you'd have good results, but you need to make sure what you're dealing with, make sure that you get your imaging, make sure that the person's evaluated. But you can have really good results with pain, and also it probably would help with warm up and increase range of motion too.
Great, thank you for that answer, Rick. We have another question here. Actually, I could answer this. The question is, will this be recorded for viewing by others? I am thinking of my coworkers. And yes, all of our webinars are recorded, including this Q&A session, and they are available on our website under the webinar link. And if you just typed in the URL, it's biowave.com/webinars. But just go to biowave.com and you can see in the menu, click on webinars, and so everything is listed there, and there's lots of good education on many different topics. When treating larger soft tissue injuries, such as hamstring strains, what pad placement do you use?
What I like to do is I like to put the pad directly over the injury site. And if you've got good palpation skills, you can usually find the defect in the hamstring, unless it's down on the tendinous junction. But if you can find the defect, I like to put the pad directly over the area where the defect is. And then I like to go, let's say it's mid hamstring, then I would probably take it up and put it on the ischial tuberosity. And then that's where I would use my pad placement. And because it's a larger area, I would probably want to do a 30-minute treatment on that rather than a 15 or 20, because it is a larger muscle and you want to get a little bit longer treatment time. And I would recommend that you do a 30-minute treatment time.
Thanks, Rick. I would also just like to share that we do have a thigh bio wrap, which is specifically for hamstring strains, but you could arrange the silver fabric electrodes. It's a wearable compression electrode garment that goes into our BioWave Home or BioWave Pro devices, and the area of the electrodes is about 6 times the volume of tissue you can treat with the conventional 2-inch round diameter electrodes. So it's really, if you've got a larger area on the hamstring and you can arrange the rotation of the of this BioWrap directly over where the strain is, because I mean you could rotate it around and use it for a quad strain or an IT band issue as well. You've got 2 pads along. You could be up toward the higher hamstring or lower hamstring or in the middle section of it. That's also a useful tool that could be used for hamstring strains as well. And okay, there's one person who said, "Thanks so much, Rick. Great presentation!" Exclamation. Is there anybody else that would like to ask any other questions? I don't see anything else coming up. Rick, you were so thorough in your presentation. You really covered so much and so many different applications for the use of BioWave in baseball and softball. We really greatly appreciate your time and presentation. And as I said, this will be available on our website shortly. So if you have colleagues that you want to see this presentation, please let them know about it, and they can see it on our website within the next couple of days. So thank you very much, everyone, for attending, and look out for our next webinar mid next month.